Come in.
So I'd be washing my hands, obviously. So hi, my name's Emily, and I'm a nursing student, and I'm going to do an assessment on you today. Is that okay?
Yep.
And can you verify your name and date of birth for me?
Cody Johnson, May 25th, 1996.
Okay. And do you know where you are right now?
At home.
And where is home?
Bow.
And do you know roughly what time of day it is?
About 2 o'clock.
Okay, that's fine. So for general appearance, he's sitting up, he's making eye contact with me. He doesn't appear to be in any signs of distress at all. So next would be hair. His hair distribution on his head, his eyebrows, eyelashes, his beard is all within expected limits. I don't see any bald spots, any kind of thinner patches, anything like that. So for facial characteristics, they're all symmetrical, and I don't see any deformations in his skull. I see no apparent lesions in his face. He does have a scar on his nose, but that appears to be old. It doesn't appear to be anything new. And is it okay if I touch you? Okay. Just let me know if this hurts at all, okay? Is there any discomfort in there at all?
No.
Okay. And I'm just going to look through your hair. So I'd be looking to see if there's any like signs of lice, mites, anything like that, and I'd be palpating for any deformations, any bumps that aren't visible with the naked eye, anything that's not kind of an expected finding. Okay. So I'm going to grab my light. You take your glasses off for me?
Sure.
Alright, I'm just going to look into your eyes, okay? Okay. And we're going to hope this light works. Let's keep bam, bam, bam. So just look straight at me, and it's dying. Alright, hold
There you
on.
go. Just keep looking at it. You gotta be gentle though.
So your pupils react to the light. Your irises are white. Your corneas are white.
Mm-hmm.
You have a present corneal light reflex. Your irises are brown. They're equal in size and shape on both sides. Your pupils are equal in size and shape on both sides and respond to the light accordingly. Are you okay if I just pull down real quick? So your conjunctiva up here pink, and there's no signs of swelling at all. And does this hurt at all?
No.
No, this.
No.
Okay, so your lacrimal ducts are patent. And are you able to just kind of look at my light rod for me?
Yes.
Look at my pen, and then look at the fridge. Don't fall in the pen. Alright, so your pupils respond to the accommodation of having to adjust your eyes from seeing up close and far away. And you wear your glasses all the time, correct?
Yes.
Alright, so you can put your glasses back on. Can you follow my pen?
Yep.
Alright, so he has, and you were able to see that okay? Nothing got blurry ever? Okay, so all your feet, like extraocular movements are normal. There's no signs of nystagmus when you're looking up at all. And I'm going to do your peripheral vision, okay? So let me know when you can see my fingers.
Now.
Okay. And how about from the bottom?
Yeah.
Okay. Good. I'm going to look in your mouth. Okay. You say ah for me?
Um,
And are you able to move your tongue side to side, up and down, everything like that? Okay. And have you ever had any pain or any issues with your teeth, your gums, anything like that?
Probably because of my
Okay.
jaw issues, but
Well, his teeth look good. They seem to be well taken care of. They're white. Doesn't seem like to be excessive staining. His gums were pink. They're not swollen. His tonsils were equal bilaterally. They were kind of tucked a little bit away, so they were kind of hard to visualize. His posterior pharynx is pink, it was moist, no signs of any swelling or redness or anything like that. He has full movement of his tongue, no lesions, his soft palate, his hard palate, all look intact, no signs of any cuts or lesions or redness in there. Okay, and can you move your jaw side to side for me? How about open and close? And can you protrude out your lower lip and then pull it back? Okay, so he does have some clicking when he goes side to side and when he protrudes his jaw out and pulls it back. I know he has a history of TMJ, so that's kind of to be expected with that. I'm just going to feel for some lymph nodes around your ears and your neck, okay? So I'm just feeling to see if there's any swelling, any pain, any tenderness where I'm pressing. Still nothing? In here? In there? No? Okay. So the other lymph nodes that I would be looking at, but we're not going to because we're not going to invade personal space kind of thing, would be the internal and the surrounding and the central nodes in your underarms, and then also your inguinal nodes in your groin. Just checking for the same thing, any deformations, any swelling, any tenderness, redness, anything like that. Okay, so your nose is midline to your face. Have you ever had any issues with that, anything like that?
I think so.
Okay. So I would have a light to actually look up, but I can't, so I'm just going to kind of use my pen light a little bit because we don't have that. And it's pink and intact. I don't see any deformations in your septum, anything like that. And then I'm just going to feel your sinuses. So you have 2 up in here. Is there any pain, tenderness, anything like that? And how about in here?
No.
No? Okay. So that would be, we'd be looking for any signs of inflammation, which could be obviously sinus infection. Sometimes they get inflamed when we have a cold sort of thing. So next I'm going to look at your ears. Do you have any pain?
No.
None ever?
No.
Okay. So, and then again, I would have the light to look in his ears, but because we're doing this at home, I don't have access to that. I would make sure to pull his ear up and back to try to straighten out his ear canal to get the best view that I can. And we'd be looking at his ear canal and his eardrum for the little hairs that are present in there, any signs of redness, inflammation, fluid, anything like that. So next we will do the whisper test. So I'm going to go on each side of you and I'm going to whisper 3 words and I'm going to see if you can repeat them, okay?
Okay.
So,
Dog, cat, water.
okay. And then on this side,
Pillow, pepper, and cookie.
Yep, there you go.
Okay.
Okay, so I'm just going to take out an actual fork and we're going to pretend with this one. The Weber and Rhine test. For the Weber test, it would be a tuning fork, and I would strike the tuning fork on a surface. Some people do it on their finger, and I would hold it directly in the center above your head, and you would tell me if you could hear it equally on both sides, if one side was louder or one side was weaker. And then the Rhine test is the difference between your bone conduction and your air conduction in your ear. So it would be a tuning fork again, and I would hit it, and I would hold it back here on your mastoid process, and then when you can't hear it anymore, I would turn it here, and then you would tell me again when you can't hear it, and usually that's a 2-to-1 ratio. God bless you. That's all right. So usually it's a 2-to-1 ratio, so sometimes people say you could hear it with your bone conduction for 7 seconds, and you could hear it air conduction for 14 seconds is what you would want to see. With something like that.
Oh, so sorry.
You're alright. Alright, I need this. Because I apparently wasn't prepared. Alright, so can I have you close your eyes for me? And can you occlude one side of your nose and just breathe in so I can... Can you breathe in for me so you know I know that it's patent? Alright, and keep that same side occluded. And tell me what the smell is.
Vanilla?
Yeah.
Okay.
All right, and then ideally I would have a second one, but I don't really have anything that I can use for a different one. So can you include the other side for me? And smell, so I know that it's eaten. And smell it again. Okay.
Vanilla.
Yeah, obviously. Are you able to close your eyes tight for me? Wrinkle your forehead. You can open your eyes now too. Stick out your tongue. And then for gag reflex, I'm obviously not going to elicit your gag reflex. I would either take a tongue depressor, or some people use like the cotton tip swabs to elicit the gag reflex by just going to the back of the throat, and obviously to make sure that cranial nerve is still intact. So can I have you like kind of put your head up for me? Because I'm just going to look at your neck. I can see your trachea with your head like that, and your trachea is midline. Are you able to swallow for me? Okay, so I see you have these little kind of like rings in your trachea of cartilage that help to keep it open. I can see those move. I can see your thyroid move up and down when you swallow. I don't notice your carotids pulsating at all. So that, okay. All right, and I'm just going to feel your carotids one at a time. And those are both equal bilaterally. And I'm just kind of going to feel in the center to feel. I'm sorry. And his trachea is midline. I don't feel any bumps, anything around the edges. And I feel your temporal arteries. And those are equal bilaterally. They're both strong and palpable. So the next part is I'm going to palpate your thyroid. That does involve kind of going behind you and kind of putting my hands around your neck. It won't be like I'm choking you though. So is that okay? Okay. So you're okay. So I would push with this side and kind of feel on this one. And it feels smooth, round, no bumps, masses, anything like that. And then I push the other way. And again, it's smooth, it's rounded, there's no bumps, anything like that. Okay. So, next I'm just going to listen to your carotids, just to make sure that there's no signs of any occlusion, anything like that. And those both sound nice and clear. And are you able to kind of tilt your head side to side for me? And up and down? And how about around? And how about back the other way? Can you shrug your shoulders for me? Okay. So next, I'm going to move on to your respiratory system. And so looking at your posture, you're not tripoding. It doesn't look like you're having any difficulty breathing, anything like that. You're sitting upright, your coloring is good, which shows me that you're getting good oxygenation. The chest rise and fall of your chest is equal on both sides. There's no, sometimes one side can kind of rise a little bit more, or they're uneven. That can happen sometimes, so, but yours are equal. So, do you have any tenderness up in here at all?
No.
No? How about down in here?
No.
Okay. Just going to go on your back. Can you actually turn so your back's like facing them? And how about any in here? Any tenderness?
No.
As I'm pressing down?
No.
Okay. I'm going to percuss down your back now. It shouldn't hurt. If it does, just let me know, okay?
Okay.
Did that hurt at all on that side? Alright, I'm going to go down the other side now. about on that side? Any pain or discomfort? Alright, so next I'm going to take a listen, okay? Can you take a deep breath? And again. And again. 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 Lovely. And one more. So his lungs sound clear. I don't hear any adventitious lung sounds, anything like that. I'm going to have you sit forward again. So next we're going to do the cardiovascular system, so just looking at your heart, stuff like that. I'm actually going to stand on the side of you to see if I see any thrills, heaps, if I can see your heart pulsating at all, which I cannot. And then I'm just kind of going to feel. See if I can feel anything. And I don't feel any heaves, thrills, anything like that, which is good. And so next I'm going to take a listen, okay? I'm going to listen in 5 different points, okay? So the first one is going to be your aortic, which is the second intercostal space on the right side of your sternum. So your sternum's right here. 2. I'm going to listen right there. And then I'm going to listen to your pulmonic, which is directly across on the left side of your sternum and your second intercostal space again. And then staying on the left side, your third intercostal space is it's known as Erb's point.
Okay.
Moving down to your fourth is your, I want to say it's mitral. And then your fifth intercostal space, mid-clavicular line on the left side, is your apical pulse. And all of those sound regular. They sound, I don't hear any extra sounds. I don't hear any signs of murmurs, anything like that. Alright, so next I'm going to have you lay down for me. You may need to shift. Yeah. You can pull the pillow. Alright. So, first I'm just looking at your abdomen, looking at the contour, looking at the symmetry. If there's any masses, any signs of pulsations from different arteries and stuff like that. I don't see any signs of pulsations. It looks symmetrical. Everything looks good with that. So next I'm going to listen. And I'm going to start by listening. I'm going to start by listening in all 4 quadrants. Okay. And his bowel sounds are normal, active. They occur in all 4 quadrants. So next thing I'm going to do is I'm going to listen to your aorta and your iliac arteries for any signs of bruise, okay? So that does involve me pushing down a little bit with my stethoscope, a little harder than I just was.
Okay.
Stay right in the center. I hear no signs of bruise at all. I would do the femoral arteries as well, but obviously we're not going to kind of get too personal in these videos. So that would be within the groin, and I'd be listening for the same thing, that kind of high-pitched noise that would indicate a bruise. Alright, so next I'm going to percuss your belly. Is there anywhere that hurts first that you kind of want me to stay away from? Okay. So he was just sick yesterday. So I'm just kind of going to be gentle with him. Does that hurt at all, or is that okay?
It's fine.
So next I'm going to palpate, okay? I'm going to be gentle. So I'm actually going to do the bottom part of his stomach last. Is there any pain or discomfort with this? I'm going to move down. Is there pain in there? Okay. So since he's having pain in his lower abdomen, I don't want to do deep palpation there, but I can do the deep palpation a little bit higher. Just because I don't want to elicit any more pain than he's having right now. So I'm just going to press a little bit harder up here, okay? Is that okay, or is that painful?
It just feels weird.
Okay. I'm sorry. Okay. So next, what we're going to do is I'm going to palpate your liver. I have to come on this side. I'm going to do my best to kind of where they can see. Alright. So I'm just
sit up or lay down?
Nope, stay laying down. I'm just kind of feeling where your ribs end. So I need you to take a really big deep breath in for me. Alright, and blow out. Alright. So I felt the smooth border. I didn't feel any sort of like masses, anything like that. So, and with obviously it would be, I spoke about the inguinal nodes earlier. I'm not going to palpate them here, but it'd be looking for the same thing of any inflammation, redness, soreness, anything like that. So you can sit up now.
Yep.
Okay, so next is just musculoskeletal assessment. I'm going to do your upper body first, and then I'll do your lower.
Okay.
So I'm just going to look at your arms. Your arms are symmetrical in size. They have hair. The hair is equal distribution on both. They're pink. They're warm to the touch. His hands are dry, but
You should
right
probably
now.
fix your computer a little bit.
Oh, they can't see me. Alright, but they can at least hear me. His hands are dry, but right now he's been washing his hands a lot. Kind of stuff like that, prevent virus and everything from spreading. So, is there any pain with me touching anywhere?
Nope.
In your elbows, any pain?
Nope.
How about down into your wrists, any pain?
Nope.
In your hands?
Nope.
So these are your, I'm going to draw a blank on these. Yep. We're just going to go with that. And your joints, any issues, kind of moving your fingers, stuff like that?
Mm-hmm.
And how about on this side? Okay. And in your shoulders, any pain at all where I touch?
No.
Okay. So I'm going to feel your pulses. So his brachial and his radial pulses they're both palpable, symmetric, bilaterally. His brachial pulses are strong. They are equal bilaterally, and the same with his radial pulses as well. And are you able to shrug your shoulders, kind of rotate them back and forth for me? And how about raise your arms? Any pain with that or difficulty at all? And how about moving down to your elbows? Bend. Kind of rotate. Alright, and how about your wrists? Bend them up and down. Spin them around. How about your hands? Any pain with that? Any?
Yep.
Okay. So, I'm going to do this. So I do have a reflex hammer at my house. I know not everybody does. So we can test reflexes. So first I'm going to do your brachial. I'm scared. And then your I can't do these. No, we really show them how to do them. And then your brachioradialis, which would be, I think it's over here, but I don't know. And then we would do the same on the other side. I'm not going to make you go through all of them on both sides. But those would all appear normal. I don't see any signs of edema at his wrists and his hands, anything like that. So the next thing we're going to do is test sensation in your arms. So I'm going to do a sharp and dull test. So this is going to be sharp, and that's going to be dull. Can you tell the difference between the two?
Yes.
Okay. Can you close your eyes for me? And tell me what it is.
Sharp. Dull. Dull. Sharp.
Good. So with your fingers, we would do vibration, because I don't have anything to vibrate in your hand. So pretty much what I would do is I would either put it in your hand or touch it to your hand, and you would tell me when it starts vibrating and when it stops, just to check with sensation in there. Alright, so for your lower extremities, they're symmetrical in size bilaterally. His hair distribution is equal on both. They feel warm and smooth. He doesn't have any dry skin or anything on them. No signs of edema anywhere. And do you have any pain like in your hips?
No.
Not even when I press?
No.
How about your knees?
No.
Ankles?
No.
And in your feet or your toes?
No.
Okay. So I'm going to feel your pulses behind your knees. Those are both equal and palpable. I'm going to feel your posterior tibialis pulse. Which are both equal and palpable. And I'm going to feel your pedal pulses. Which are also both equal and palpable. So I'm just going to go behind you. Are you okay if I press on your spine a little bit? And is there any pain in here when I do this?
No.
Not even as I'm going down?
No.
Okay. So the next thing that I need you to do is, can you stand up for me?
Sure.
I have to adjust this. And can you bring your knees up? How about bringing your hip out to the side? No, your hip out, bring your foot out.
Oh, okay.
And then the other one. And how about rotating your hip in and outward? And the other one. Any pain with that at all? And can you go side to side with your spine? And rotate. Can you bend forward, touch your toes? Good. And how about your ankles? Kind of twist around, flex up, flex down. And same with the other one. And can you curl your toes and uncurl them? Alright, any pain, any difficulty with that, anything?
No.
Okay. So I'm going to have you sit again. That's right, I'm making you kind of get up and down. So, I'm going to do your reflexes on your lower extremities now.
Okay.
So I'm going to do your So your reflexes appeared to be within expected range. They weren't like over, like what's to be expected. They weren't over when I hit your knee, like your leg didn't kick up and kick me, or they weren't absent. So next thing we're going to do is the same thing I did on your arms, the sharp and dull. Okay.
Close my eyes.
Nope, not yet. So this is sharp, and this is dull. Could you feel the difference between the two?
Yes.
Okay. So now you can close your eyes. Can you tell me what it is?
Sharp?
No. What do you got?
Is that the sharp?
No.
Something feels sharp. That dull?
No.
Okay.
That's sharp. Okay, so this is sharp, and this is dull.
Okay, well, when you were doing the dull, something felt sharp.
Okay. So how about on this one?
Was that sharp?
Yes.
Okay.
And how about now?
Dull.
Okay. So something was feeling sharp to him. I'm feeling it, and I don't feel anything sharp. But that would be something to report as a little abnormal. Is that on his right lower extremity, he was having some difficulty differentiating between the two, which is okay. It can happen. So, do you have any questions for me?
I don't think so.